All right, hello, and I'll be talking about respiratory acidosis and some of the things that your body does to try to compensate this effect. So, the normal blood pH is between 7.35 and 7.45. When the blood actually goes below that, this is when acidosis occurs, and that occurs from increased hydrogen ions being released. Um, and then the lungs are normally the regulators of the partial pressure of CO2. So whenever you expire or exhale, it's going to release the trapped CO2 in your blood, and that's going to be a sort of regulatory system to aid in regulating blood pH. So cells are constantly producing CO2 whenever they're respiring from metabolic processes. And then the kidneys actually develop a response to the increased or the decreased pH of the blood through a couple different ways, acutely and chronically, which I'll talk about. Okay, so in the case of respiratory acidosis, the body's ventilation is impaired, which is going to limit the body's ability to expel the CO2. So then the partial pressure of CO2 is actually going to increase. This increase in partial pressure is going to affect the pH by decreasing it. So the blood pH is going to be decreased, and that can lead to a variety of problems. And then the body's going to actually try to fix this by increasing the metabolic processes by increasing the amount of bicarb in the body. So immediately, though, the increased CO2 is going to shift this equation to the right, and then that shift is going to lead to more hydrogen ions. And these hydrogen ions is what actually decreases the blood pH. And those are going to be picked up primarily by like red blood cells and intracellular proteins that work to maintain the blood's homeostatic pH of the 3.5 of the 7.35 to 7.45. And then over time, the actual renal system is going to work to increase the amount of bicarb in the blood. So acutely, and within a matter of hours or so, the renal system is going to work by producing 1 millimole of bicarb for every 10 millimeters of mercury of CO2 the blood has in it. And this isn't really a lot, but it's going to try to aid in monitoring the blood pH. But then over time, in a magnitude of like 3 days, it'll increase the renal retention of sodium bicarbonate will increase, and this is sensed by the proximal convoluted tubes to the increased partial pressure. And this is a good way for when people have like COPD for a long time. They're constantly not expelling enough CO2, and then the kidneys work to excrete the H plus ions as well out in the urine to try to monitor the blood pH. All right, so now that we've talked about some of the pathophysiology, we can talk about some of the causes of respiratory acidosis. So the primary cause is going to be hypoventilation. So breathing slowly and not exchanging enough gas is going to result in the acidosis. And that can be through a variety of different symptoms. So COPD is a very common one. That's chronic obstructive pulmonary disease. So the alveoli are physically harmed from years of smoking and abuse, is going to prevent their ability to exchange the gases, and CO2 is going to be trapped in the lungs. And that's going to lead to the increased partial pressure of CO2 like we talked about. As well as airway obstruction. So if something was caught in your actual bronchi, or you have a tumor in your lung, which is preventing the gas exchange from occurring throughout a whole lung, that's going to cause the hypoventilation of one part of your lung, which would then increase the partial pressure of CO2. Then drug overdose, so like an opioid, someone that injects heroin or morphine is going to, that's going to depress your CNS, and that's your body telling you to basically breathe, is your central nervous system. And with that depressed, your breathing is going to be slower, and then you're eventually going to not breathe enough and exchange enough gas, resulting in the acidosis. And then another one that's a little different is the diaphragm neuromuscular disease. So with the neuromuscular disease of your diaphragm, your ability to contract and relax your diaphragm is hindered. So you can't actually expel the gas out because your diaphragm won't function properly. And then, like a traumatic injury to your brainstem is also going to cause respiratory acidosis. So if you're in a car accident or something and your CNS is injured, which is going to prevent your body from breathing correctly. And those are all problems that are associated with, or some of the causes of respiratory acidosis.